section on that. I expect you to do very well.
Oh, shoot.
For the bacterial morphology as far as shape, stain results, etc. Now, if I was to say, what is the gram-stain reaction for Staph aureus?
Gram-positive.
Not gram-positive purple.
Gram-positive cocci.
Gram-positive cocci typically arranged how? Clusters, typically in clusters. What about E. coli?
Rod, gram-negative rod.
Gram-negative rod, correct.
So we're gonna get that counted off? We know right.
Not on the quiz.
Okay.
As far as atmospheric conditions, what is a capnophilic condition?
They like
They like CO2 increased.
Yeah.
Increased CO2.
5 to 10%.
What about microaerophilic?
More air.
Less.
Micro.
Oh, micro, that's all it is.
Decreased oxygen.
Like
So
to
if you think
find
about what I'm doing with that candle jar.
decrease.
I'm burning the oxygen to increase the CO2. That candle jar is both capnophilic and microaerophilic, which is why that candle jar is so effective. What is a facultative organism?
They need it a certain way.
One that can exist
Either
in
way.
multiple
Okay.
environments.
It's the opposite.
Yes. It is basically a perfectly happy and anaerobic environment, but if oxygen is present, it'll use it. It'll utilize it and it's happy for it, but it doesn't need it. Most of your organisms are facultative. Like even Staph aureus, we grow it in, just room air incubator, but it's facultative. It doesn't have to have that oxygen. It's appreciative of it. What is the metabolism used by aerobic organisms?
Aerobic, they need air, right?
They use ATP.
They all use ATP.
ATP. Will they use fats and glucose and proteins to make?
Oxidation.
Okay. The other one.
They're using that oxygen. What about anaerobic?
Fermentation.
Fermentation. What's the difference between disinfecting and sterilizing?
Sterilizing kills
Cleaning,
everything,
killing everything.
and disinfecting allows some of
Disinfecting, you're trying to get rid of the pathogenic organisms. Sterilizing, you're killing everything. Why do we not always use sterilization?
Not cost effective. It's not always necessary.
Not cost effective. It's not easy. It's very difficult to achieve sterilization. The terms bacteriostatic and bactericidal. What is bacteriostatic?
That's
Slows it down.
Control
that
of
they
bacteria.
can't grow more.
It slows down
Controlling
its growth.
Controlling its growth. The bacteria is still alive. It is just unable to spread. It's in stasis. It's just hanging out. Bactericidal kills it.
Cytal.
Antibiotics are not bactericidal.
They're bacteriostatic.
They're bacteriostatic.
In your body.
Antibiotics cannot kill bacteria. What they can do is hold them up and let your immune system take them out. I'm not gonna go with the gram stain. You should know what that is by now. What is an opportunist?
Anyone that takes advantage.
Organism that takes advantage of immunocompromised host.
Yes. What types of organisms are capable of becoming opportunistic?
Normal?
Anything. Under the right circumstances, anything is capable of causing diseases. If it gets in the wrong spot, if you're immunocompromised enough, some of them are more notorious for it than others, like staph epilepsy. But in the right set of circumstances, advanced chemo or whatever, anything can cause disease. We do a gram stain and we've got a gram-positive cocci. That's all we know. What is the first thing we're gonna do to this
We're
organism?
gonna do the catalase.
We're gonna do the catalase test. What is that gonna tell us?
That's gonna tell us if Staph aureus, so if it's micrococcus.
Will not tell us that.
It'll tell us if
Staph
it's staph versus strep.
Staph versus strep. If it's catalase positive, it's a staph or a
Colase,
micrococcus.
the coagulase is what tells us if it's
Yes.
micrococcus, or, that's right. So
There is another test method for Staph aureus other than the coagulase. It's called that slide test or the clumping factor test. If that clumping factor test is negative, what does it mean?
That it's not Staph aureus. I can't
It
remember.
means nothing. 5% of Staph aureus do not produce clumping factor. Even if that is negative, you've got to do the 2 coagulase. That's why it really bothers me that micro labs still do that clumping factor test. It's fast and it's easy, and that's the ones they go by. You're wasting your time, in my opinion, but I don't get to make these rules. If it's negative, you've still got to do the 2 coagulase. Just do that first and be done with it. So the 2 ways to determine Staph aureus, catalase positive, obviously. The 2 coagulase test, and then that slide clumping factor test. And to me, I don't like the clumping factor. I think it's a very low value. And that answers number 10, how to differentiate Staph aureus from the other staphs. Coagulase test. I mentioned on number 11 on the study guide. On chapter 14, the last slide is a summary. That is a really, really good slide. Now there's stuff throughout this you're gonna need to know, but this tells you a lot. Staph aureus tells you about it. Staph epi, important nosocomial infections. What's unique about Staph epi? What is it like? It likes artificial materials for some reason. It likes to go to those artificial heart valves and those indwelling ports and things like that. It's got an affinity for plastic. We don't know why.
So it likes catheters too.
Yeah. But it likes to attack when you have those like endocarditis, which is heart infection. If it's an artificial heart valve, it's usually Staph epi. It likes artificial materials.
What I meant plastic, why is it all over our skin?
Yeah.
So
Because it hangs out there anyway, and it's never a problem. It becomes a problem in other circumstances.
So even people with like warts. Warts.
Yeah, they
Like I
have
said, there's some affinity for plastic. It likes it. Staph saprophyticus. 90% of the time we could care less. It's just a coag negative staph. When is it important?
UTIs.
And women, child, sexually active young women.
Yes. UTIs and sexually active young women, it's significant. I think everybody else, well, you're just gonna stop at coag negative staph. And to ID saprophyticus, what antibiotic disc do we use?
Nova bias.
Novabiocin. And like I said, there's a lot of, that summary, chapter 14, it's a good spot. Chapter 8, I said it's a fairly short PowerPoint, I think it's 10, 12 slides. Ton of good information, especially it mentions distinctive characteristics for several different things. What organism is notorious for swarming? Proteus.
Proteus.
What? It mentions 3 that have very distinctive odor. What are they?
The sock is Staph aureus.
Dirty sock, Staph aureus.
There's one that's like grapes.
Fruity, grape-like for Pseudomonas. What else? Proteus I described as putrid. How does the book describe it?
Burnt
Burnt chocolate. Totally wrong.
Question.
Yes,
Was that Proteus mirabilis?
both Proteus have about the same. There's 2 different significant Proteuses. They both textbook says burnt chocolate.
Which one should we know for the test?
Burnt chocolate. That is always your textbook answer for the smell of Proteus. Yes.
And then, as far as mustiness or mousiness, that was Haemophilus.
Haemophilus got a mouse. What smells like a dead mouse in your house? Good point. I forgot.
Grimy.
Oh, and then you did.
So those distinctive odors or distinctive morphologies like the swarming of Proteus, those are always good. One of these streps had a very distinctive characteristic.
That's what the tedious.
Strep pneumo, alpha hemolytic, the little inverted colonies, looks like a
Because of the
coin.
lysis.
Gram-positive, lancet-shaped diplococci, because they have, the cocci tend to be a little bit pointed. We saw a couple of those in there today. Very distinctive. These distinctive characteristics, you can count on always being tested on those. Now, later, registry, clinical exam, etc. Because things that are that distinctive, it's like immediately, it's like, I know what it is. You've got to remember those. As far as the media, and I think I mentioned that on your review, all that media from your homework, there is a matching section. Where you'll be matching media to descriptions.
Is it literally every single one of those?
No,
Okay.
it's a selection of 8, I think, 8 or 10. But let's talk about the most common. Yeah, let's start with McConkie.
Yep.
Number 1, it is selective. Selective for what?
Lactose.
Fermenters. No.
Selective for gram-negative organisms.
Because gram-positive is blood.
It's differential.
It's differential for lactose fermenters. What will they look like?
Lactose will be pink,
Yeah.
If
non-lactose
they
will
can
be
ferment
clear.
lactose, they will be pink.
Hot
If they
pink.
cannot, they will be clear. That is not to say that one is more significant than the other. Because E. coli, a very significant organism, is pink, ferments lactose. Shigella, very significant organism, causes massive diarrhea outbreaks. Does not ferment lactose, it'll be a clear color. That is not a term of significance, that's just a differentiation. So if we were using microbiology stool culture, we see E. coli, we're gonna ignore it. It's supposed to be there. What we're looking for there is those clear colonies. Urines, the opposite is true. We're looking for those pink ones because we're suspecting E. coli. So the significance is not based on the color. That just gives you a hint about what it's doing.
Where to go from there?
What is the causative agent most of the time of strep throat?
Pesco B strip A.
Group A strep. What's its name?
Diogenes.
Streptococcus pyogenes. When we're saying group A strep, what is that A?
It's the
Lansfield
Lansfield
group.
classification.
Lansfield classification based upon its antigens. What is group B strep?
That is a
Streptococcus agalactiae. What Lansfield group is strep pneumo?
It
You
doesn't
don't
have a
have
group.
It is not Lansfield classified.
I knew, I said that this morning.
She said that's his favorite strip. He's gonna
It
ask
is,
us
and
that.
I said, he's gonna ask us, does it have a group, and it's a trick question, cause it doesn't. I said that this morning.
What is something we could do to strep pneumo to make it completely non-pathogenic?
Yeah, because it's gonna auto.
An autolysis.
Not necessarily, something mentioned in the lecture. You do something to remove that organism's capsule, it's completely inert.
It's
All of its toxicity and all of the danger that causes it to be pathogenic is a factor of the capsule.
That's its.
If you remove the capsule from strep pneumo, it's completely inert organism. It's capable of doing nothing to harm you. As far as flow chart, I said you had better know this, and that's true. Without looking, how do you differentiate Enterococcus from group D strep?
Oh, the PYR.
PYR.
For the 6.5.
I will accept both on the test. Even though that 6.5 sodium chloride broth is not on your flow chart, that is correct. Enterococcus will live and grow in that, perfectly happy. Group D strep will not. I put PYR on your flow chart because that is the most common, because that's what labs typically use now, because it's faster. What are the three most common hemolysis patterns?
Beta, alpha, and gamma.
Beta, gamma, which is none.
What's the rare one?
That's
Yeah.
beta.
Alpha prime. And that alpha prime,
Optimus Prime.
you'll have a little colony, and real close to it will be blood, will not be hemolyzed at all. And then this will be beta hemolytic. You'll have that one little red ring right up close. And you will almost never see this with the exception of one organism that we're a long way from talking about. When we're talking about IDing some of these strips, we mentioned using these discs. And the discs are identified according to the strep. Like the A disc to identify group A strep, what is in it?
Bacitracin.
Bacitracin. What is in the P disc for strep pneumo?
Opticin.
Opticin. What's in the B disc?
B disc. Oh, bile.
It's not
No.
No.
Penicillin. Whatever.
Trick question has nothing to do with strep.
Yeah, I was gonna say I don't
Uh,
remember B.
There is actually a B disc, but it's like a weird random antibiotic that nobody uses.
What's that? What is it?
Doesn't matter. No,
Check
it's
that out.
too much information. Kick something else out of your brain.
They don't use B disc for group B strep. Ooh, good one. What organism is identified by the CAMP test?
Group B strep.
Group B strep. What is the other organism that you gotta have to make that work?
Staph.
Staph aureus.
Yeah, because they can't. it's
You've gotta have that streak of Staph aureus and then the streak of unknown that cannot touch. It has to be like a millimeter apart.
Make the arrowhead.
Then you'll get that arrowhead of enhanced hemolysis.
See, I wish you would've said something about arrowhead on that question. I would've got that right on my quiz, because I'd have missed that. If you would've said arrowhead, I
It's
would've
an
got it.
area of enhanced hemolysis. It is usually arrowhead shaped, but not always. As far as the alpha streps, what are the two most significant groups? Those are both beta hemolytic.
Yeah.
Pneumo and Viridae?
Pneumo and then viridans, which is actually a group of
Of five.
organisms, multiples. The strep pneumo being the most significant of those. But those are notoriously alpha hemolytic. And you do need to know hemolysis patterns for these organisms we talked about. Staph aureus, beta. Staph epi, Staph sapporo, typically non-hemolytic. Streps, group A, group B, are beta hemolytic. Pneumo is alpha. And when you're talking about the streps, group A is more hemolytic than group B. They'll have a larger area of hemolysis.
Question,
Yes,
so Staph Elococcus species can be put on blood agars and hemolyze blood.
yeah, Staph aureus is beta hemolytic. And the coag negative staphs like Staph epi, Staph saprophyticus, some of the other staphs that we only touched upon, those are typically non-hemolytic. Another thing to keep in mind, if you're looking at colonies, a colony of staph is bigger than a colony of strep. When you look at it on a gram stain, the cocci are bigger on staph than they are on strep. If you think about it, a larger bacteria should make a larger colony, and that's why it's bigger. What is an example of an enriched media?
Enriched media would be like what, like the chocolate, yeah.
Yeah, chocolate.
Chocolate's
Blood
one. What's the
agar.
most common enriched media?
Blood.
Blood.
Yeah.
It's just a plain agar base that has been enriched with blood. What is an enrichment broth? As I said on the very first, there is a difference between enriched and enrichment.
Would that be the bio, or would that be like,
That is not an enrichment broth.
so is it the other one, the,
THRG.
Not biocoagulate typically.
no?
Is it salt?
It is to enhance the growth of very small amounts of organisms,
Like salmonella?
like salmonella broth.
Isn't it treated to inhibit the growth of,
Typically treated to inhibit the growth of normal flora. What is a transient organism?
Something that
I've
stays
got
temporarily.
It's on your body temporarily, days, weeks, maybe months, and then it's gone. What is the definition of a pathogen?
Something that causes
Organism
microorganisms.
that causes disease.
Microorganism capable of causing disease. So you need to know the difference between normal flora, transient flora, pathogen, opportunist, which can cause disease under the right circumstances. How many questions is this thing? 50 questions.
50.
That. We come back. Ooh, good question. I don't even know if I should review that. I should see if you're reading. That's a good idea.
Well, you're nice. That's not a good idea.
Give me a couple of sites as far as doing gram stains. What's a couple of sites that would be of no value whatsoever to gram stain?
GI.
Anything GI related, stool, etc. What else?
Anywhere that there's a whole bunch of normal flora.
Anywhere there's a bunch of normal flora. Throat cultures, we did them in there, but you don't gram stain throat cultures because you can't visibly see the difference between the pathogens and the normal flora. So what's
The
the point?
genitals.
Genitals.
Yeah, so.
GI again, stool, anything like that, anything where there's just a ton of normal flora, the gram stain is of no value whatsoever. What sites is the gram stain of the highest value?
Sterile sites.
Sterile sites. What's a site that should always be sterile?
Your lungs, the lower section of your lungs.
Lower lungs. What else?
Your spine.
Spinal fluid, big one.
Yeah.
blood?
Blood, big one. Any others you can think of?
Bladder is supposed to be sterile.
There's actually stuff in your eyes.
Oh, no.
Maybe not yours, you burned yours out with a laser. Those areas are the best for gram stains because anything is significant. There is no normal flora. So at that point, you're not even looking to identify bacteria, you're looking to see anything. So they're of the highest value. What could you do to concentrate these to make sure you really catch it all?
Stick
Do you have
them
on
down
plates,
and
you know, that are.
Talking about gram staining, we're not setting it up.
Wait,
Swab it real good.
Proper, yeah, proper fluid.
If it's a fluid, you can centrifuge it to concentrate it.
Okay.
Cytocentrifuge it, which is even better. And is there a picture of the cytocentrifuge in your book somewhere?
maybe.
It's a holder that holds a slide like that, and it has basically a plastic funnel that you can then fill with liquid. When this is spun in a centrifuge, a special centrifuge just for this, it will concentrate all this fluid right there.
Wow.
So you've got those, you can probably get 10 to 15 drops in there. You got 10 to 15 drops taking the space of one drop. It's all just boom in one area. The downside of this is by being spun like that, it tends to distort things a little bit. Because think about it, this stuff is basically hitting that glass slide at high speed.
Yeah.
So it's distorted a little bit. But remember, sterile fluids, we're not looking for ID. We're looking for presence. So if you can put this much material in that small of a space, you don't have to spend an hour going over a slide looking at the whole field, because your whole field is that big. When I say that big, that's a big slide. It's the size of smaller than a dime.
If there was anything in there, would it be too thick?
No, because there should be nothing
In there.
Even when you do find organisms from a site like that, it's usually not a ton. When you're looking at a spinal fluid, one bacteria is highly significant. And if you find a legitimate meningitis case, you'll be lucky if you find one.
Oh, unless it's viral, right?
What is our body's first line of defense against infection?
Skin.
Skin. Number one. What is our most significant line of defense against infection?
Mucus.
Our immune system.
Oh.
Yeah, inflammation, redness.
But think about it. Once your immune system gets involved and starts fighting bacteria, it's already lost the first two battles. The bacteria has already penetrated the body. It's already won that fight. It is spread in the body. It's won that fight. Now we're at round 3 before the immune system gets involved, which is kind of a downside. What's a term for a organism that requires special handling, whether it's CO2 or special media or something like that, because it's doesn't like to grow that well? Fastidious.
Picky.
Like gonorrhea is a very fastidious organism. It will not grow in blood. It will grow in chocolate. It's too fastidious for blood. And there's a lot of organisms like that. The mousy smelling one, Haemophilus, it don't like blood. It'll grow in chocolate. Is Staph aureus normal flora?
Yeah.
Very much so. Where?
Your skin.
Skin. Is strep pneumo normal flora?
Yes.
Yes. In the mouth, upper respiratory. Is group A strep normal flora?
Yes.
No.
No.
Group A strep is never normal flora. It is always a pathogen.
So if they're.
Even the carriers, it
Okay.
is still a pathogen. It does not happen to be affecting them right now.
Okay, that's.
But it is a pathogenic organism. There are very, very few that we will cover in this entire class that are always a pathogen. Group A strep is one of them.
That group A, that's pyogenes, right?
Pyogenes. Other ones that we'll go across that are always pathogenic would be like gonorrhea, syphilis, bubonic plague, pretty much pathogenic. Salmonella, always a pathogen. You know, so there's not many. I mean, you can count on 10 fingers pretty much the number of organisms that, no matter what, no matter where they are found, they are a pathogen. Group A strep is one of them. It is always pathogenic.
Tuberculosis.
Talking about media, what does the term selective mean?
It'll let one grow and inhibit the growth of another.
It'll let one group of organisms grow while inhibiting the growth of others. And differential, not necessarily selective, it can be, but that's to show you differences in
Visual.
metabolism or function or something you can visualize that is different. That is differential. Think about it, it looks different, differential. So let's go over some medias from your homework. McConkey, is it selective?
Yes.
Yes. Is it differential?
Yes.
Yes. CNA, is it selective?
No.
No.
It's nutrient.
CNA is selective for gram-positive organisms. Is it differential? Yes. Why? Contains blood. That means it's differential for hemolysis.
So if it's selective, is it always gonna be different?
No.
I should tell you my question too.
What about PEA?
Selective.
For what?
Don't remember.
Oh, staff and.
PEA and CNA
Gram-positives.
are very, very similar to one another. They're both selective for gram-positive, they're both differential for hemolysis. They even look the same, different chemicals. EMB. Have they done that one on their homework yet?
Oh,
EMB?
oh, where is that?
That's the bottom.
EMB is selective for, it's similar to McConkey. It is selective for gram-negative organisms. If I ask you a question and say, what organism belongs to Lancefield Group A? You better not write Group A strep.
Right, strep.
Better write Streptococcus pyogenes or S. pyogenes. And you better know the difference when you're abbreviating S, whether you're talking about a staph or a strep.
So which all do we have to include in that? Cause it says A, B, C, D, F, G, and N.
How many streps did we go over in class?
All of them.
Extensively.
A and B and D. I'm,
Agalactia.
But the D don't have a name.
yeah, do you want bovis for that?
No.
Or what do you want for D? Cause I was kinda confused there, just group D, there's no name? Okay.
We didn't
What,
cover
Group
that.
B or-
The ones we covered heavily, Group A, pyogenes. Group B, Agalactia. Strep pneumo,
Right. S,
Enterococcus. Those are the ones we covered extensively.
yeah.
Those other ones I said, don't even study that section, because I want you to have known the name, like Aerococcus, Leuconostoc, Gamella. You've heard of it now. I've achieved my goal. I don't go any farther than that.
We need to know the 5 for the viridans, right?
No, you need to know viridans.
Okay, you just need to know that in
No
general?
one actually goes down to ID those. When you get to that point, it's viridans.
Okay.
We don't care about the ID at that point. God, know the difference between genus and species, please. Genus is capitalized, species is lowercase every time. If you do it any other way, it's wrong. Know your gram stain procedure, know the reagents in it. For God's sake, know which one is rewarded. That's probably gonna be on every exam you have. From the study guide, I said know the conditions of an autoclave.
Oh,
15 pounds.
55 for
15,
minutes
15,
and 100,
121.
yeah,
15
Celsius.
pounds pressure, 15 minutes, 121 degrees. Yes.
One thing I do,
15 minutes.
have it at 121.
I mean, Celsius.
Moist.
We talked about some of the distinctive characteristics of organisms. There is a matching section covering such.
Wait, what?
Distinctive characteristics of organisms, there's a matching section. So if I give you a bunch of different smells, you better know which organism causes it.
Okay.
Or if I give you distinct morphologies, you better know what causes that.
Okay. Boop, boop, boop. Boop, 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 boop.
What is that for?
Isolation.
Streaking for isolation. What is that for?
Oh, to
Oh,
see. I remember if like something will grow near
to
the
see how long
line.
it can
Pure culture.
withstand.
Colony counts.
Yeah.
For respiratory specimens and urine cultures, a lot of doctors want colony counts. So you use a calibrated loop, much like what we've been using in class, because those are calibrated. And using that, when this grows, you can count, there's 15 colonies. You can take what size that loop was and determine how many organisms per milliliter. Like the ones you've been using are, I think they're 1 to 100. I'm used to using a smaller loop for urines. So if you count, that's to the thousands. So if when you're done, it grows out, you have 15 colonies,
15,000.
15,000 colony forming units per milliliter. Simple as that.
So you use the green loop for your.
Use the green loop.
Yeah.
The reason we have all those blue ones that we're using for everything is because Becky screwed up and ordered the wrong size. So I took them all. Because she likes these little ones. And we have some of those as well, and we'll do that later.
Yeah, government entities.
Case study, that if you know your flow chart, will be the easiest thing on the test. Matching over the media, we've already talked about that. That should be real easy too. What is the most significant thing Group B strep can do?
Cause meningitis.
In who?
Newborn.
It's a problem with newborns, because mother had it, passed it to baby, causes big problems
Oh,
for baby.
yeah, and they have
All
to
women,
test.
pregnant women are screened for it.
At 35 weeks.
If they get.
So if we're talking about most common infections, Group A strep. Most common infections caused by strep throat. Group B strep, the most significant thing is the mother-baby thing. Childhood, infant infections. Strep pneumo,
I mean, that's the.
Sinusitis?
pneumonia.
Yeah,
Pneumonia.
I mean, that's like.
Streptococcus pneumoniae, pneumonia. Significant cause of bacterial pneumonia. Staph aureus,
That's.
a whole host of problems.
Yeah.
Wound infections is a biggie.
And
Uh,
toxic shock syndrome.
What's something that it can go on to cause?
Death.
Skin flesh eating disease.
Hepatitis.
I know.
Rarely, that's Group A strep. Staph aureus, toxic shock syndrome,
Okay.
remember that?
You just said that.
It was? Can, but like I said, most significant is like, it causes all these wound infections or whatever, it can cause toxic shock syndrome. Group A strep, let's say Bianca has strep throat right now. What condition could she potentially get 3 weeks from now?
Oh, glomerular nephritis?
Possible. There's another one. Rheumatic fever.
Right.
My cousin got strep throat and she never got it treated, and then now she has severe psoriasis. Like her entire life. She said.
It can cause scarlet fever, rheumatic fever, nephritis, due to these antigen antibody complexes tearing the kidneys up. Group A strep is particularly nasty. That's the flesh-eating disease where your body parts start falling off. Which I really think that we should like intentionally inoculate rapists and murderers with that. Let them die slowly over a month. Pieces, dissolving slowly in a cell. That'd be
Put it on
awesome.
their pee-pee.
So as far as this exam, as far as the case studies, there's only a couple.
3 is a few, couple is 2.
I can add more.
No, thank you.
Easily answered with nothing but your flow chart. You know that flow chart? Cakewalk. If you did your homework on the media, the matching section should be a cakewalk.
I'm gonna have to read.
There is a true false section, and some of that's including the media. Like if it says Staph aureus will grow in McConkey, true, false?
False.
False.
Only on blue plate.
So, if you know your media, that helps there as well. There is a matching section on the different morphologies, bacillus, cocci, diplococci, etc. There's a matching section over the distinctive characteristics like the smell, fruity, grape-like odor, Pseudomonas aeruginosa, swarming, proteus, things of that nature. And the rest of the exam is all multiple choice, and honestly, I think this is as easy as it gets. Well, I know this is as easy as it gets in this class. The reason I said a couple weeks ago, this first exam, you have got to knock it out of the park. Exam 2 is the hardest exam in this program. Historically, whatever you get on this exam next week, the next exam will be 15 points lower.
God.
Exam 2, looking at grades, you're gonna do 10 to 15 points lower. It's hard. Exam 3 is hard, but usually it's a little bit better than 2. And we're talking about averages here. That's not to say you're gonna make 70 on this one and a 92 on exam 2. It happens, but law of averages says that's probably not gonna happen. So just warning you, study hard for this one, start off with a good grade, because now we're about to start getting hard. That's what I got. I pretty much covered the whole exam. And that study guide, if you know that study guide, I've told you 90% of what's on the test on that study guide. Know your flow chart, do your homework, and know that media. Know whether it's selective or differential and what it's selective for. Know if it'll grow a gram positive or a gram negative organism.